Hello, everybody. Welcome to another interview of Sikh Health Network. Today we have a special guest, but before I introduce herself, I'm going to introduce myself. Um, my name is Sahej Singh Johal. I am a junior at Camp Lindo High School, and I'm one of the founders of Sikh Health Network.
Hi, my name is Nimr Johal, and I am a sophomore at Miramani High School, and I am the other co-founder of Sikh Health Network.
Welcome, Dr. Grewal.
Thank you.
It's a pleasure having you here. Can you please tell us your medical specialty and your credentials?
Sure, yeah. So I'm a dentist by profession, and I graduated from UCSF in 2007. I did my education in dentistry also in India, but in 2005 I graduated from UC Davis, where I studied public health. So I've been practicing dentistry for 15 plus years now in the Bay Area in California.
That's awesome. So what motivated you to become a volunteer to do community service or seva with the Sikh Health Network at the El Sobrante Gurdwara, like one of our sessions that we had today?
You guys. So I think it's, excuse me, it's very inspiring to see youth come out and take out their precious time and volunteer and be involved. I think life gets so busy. In my profession, it can get very busy, and then family life is busy. But when I saw you guys, you're so proactive, you're so enthusiastic about volunteering. I got inspired to be a part of it. So you inspired me to join this.
Can you tell us a little about your journey and why you're here and how you got here? So how did you grow up? What inspired you to take on a path of medicine?
So I grew up in a excuse me. I grew up in a farming household. My dad's a farmer by profession, and he also always inspired us to pick a profession which would make a difference, which would always be more prestigious, more education. So I always wanted to be a doctor. Um, and My older sister is a dentist, so that's something I saw as an example in front of me. And I pursued dentistry in India, but moving to the United States was very key in giving that profession a new perspective, because dentistry in America is very advanced. So I was very excited to be a part of it.
Yeah, I think that's an incredible thing to be a doctor or work in the medical profession. And I know that it's kind of hard to gain access to a lot of like the educational resources to become a doctor and things like that. So, what obstacles did you have in your journey, and how did you navigate those?
So I think one of the biggest obstacles I had was being a foreign graduate or a foreign student in this country. There is a lot of there are a lot of barriers, financial being one, and also it's very competitive. When you're from a different country, you train in a different country to come and be educated here to be up to speed, up to par with the clinicians who practice here. So I think that was one of my biggest obstacles, to come from another country, which is a developing country, and to come here to United States where the profession of dentistry is more technologically advanced. It is much more forward. So that was my biggest challenge, but I had a lot of support of family, and I was able to pursue that.
As time goes on, people change, professions change, and it's just your way of doing things change. So in around 20 years in the future, how do you see the role of your medical specialty change?
I think technology is penetrating every aspect of medicine in a very big way. And I think dentistry it has been very heavy in technology since a while. We use x-rays, we have machines which mill and make crowns in our offices. That's been going on for many decades now. But now, since we're doing surgeries where they place implants, there's templates which can be made with machines. I think in 20 years things are going to change quite a bit. There will be imaging which will be more technologically advanced, CT scans, and using stents and guides for doing surgeries and making it much more easier and simple will be routine. And I hope one day we can do robotic dentistry where I can just sit in my bedroom and go like, I'm just going to press some buttons and the robot is going to do fillings and surgeries. But jokes apart, I think dentistry is going to be very tech heavy in the next 2 decades.
I completely agree with you. I think with the increase of technology in the medical field, it also, while it makes life easier, it also makes like the education process a bit harder trying to understand these different technological aspects. So, what is your advice and message for young and inspiring students in high school and college who hope to follow medical professional paths?
I think the most important thing, which I would say, which I wish somebody had told me, is that when you are 17, 18, 16, 19, in that very impressionable age, I would go out and talk to and hang out with people in medical professions as much as I can. Because at that young age, we have a lot of misconceptions and a lot of preconceived notions. We don't know the whole story. Medical profession, no matter where it may be, it's very glorified because it's very high paying for a lot of people, but it's also something that requires a lot of sacrifice, a lot of commitment. And since you're dealing with the human body, whether it's teeth or any other organ, there is very little room for error. So there is, you always have to learn to put yourself after the patient, and that requires a lot of selflessness. So I think high school students like you guys, you it would really benefit if you got a more in-depth look into a clinician's life as to what are their sacrifices, how do they function every day in terms of putting themselves after their patients, and that takes a lot of commitment.
I totally agree. Having that experience, even as a high school student, is really crucial if you want to go in the path of medicine and community service.
Absolutely.
And with that being said, this concludes the interview. But thank you so much for your time.
Thank you. Thank
Thank
you
you
for
so
having me.
much.